on to some more serious anxiety disorders.
Sure.
I don't even know, maybe you could kind of lead me where we should talk about that.
Sure. Well, I mean, there's a wide variety of manifestations of anxiety. You could typically, I mean, people, well, I don't see many people who come complaining of phobias, for example. So that's not a common thing. And in any case, I don't know that I would have any strong recommendations for that, frankly, other than to go see a therapist. Probably the most common one is a generalized anxiety disorder that people come in with if they have a diagnosis. Just, you know, often they worry quite a bit, would be one of the defining features on that one. But panic attacks are quite a common reason for people to come as well, and or panic disorder. And sometimes what goes along with panic disorder is agoraphobia, which would be well, for many people it manifests in not wanting to, you know, leave a certain safe zone, not wanting to be without certain safety people, for example, or even safety objects, and so that can quite severely impact quality of life, right? Because some people are no longer comfortable going to work or can't work because they aren't comfortable leaving the house and so on, or even going out of their neighborhood. So that can be that. I mean, of course, people have a hard time coming to see me in the clinic, and at that point, but we could certainly arrange house calls and stuff like that as well, should the need arise. There's a number of other anxiety disorders. Obsessive compulsive disorder would be another one that people get sort of talk about a lot.
For these anxiety disorders, panic and OCD, are they generally because of a trauma, or can they be caused by a nutritional issue or hormonal issue, other sort of naturopathic?
Yeah. Well, So, well, certainly like PTSD, post-traumatic stress disorder, would almost by definition require a trauma. But things like panic, not necessarily. You know, people will have experienced panic attacks. I mean, it's not uncommon at all for people to experience panic attacks. The reaction to that panic attack is almost what predicates, you know, the how much it affects you psychologically after. So you can, if you react with, or if you have an intense fear of panic attacks, or if you register certain bodily sensations as highly problematic, you are more likely to have a negative evaluation of it, and then so it becomes more of a problem. So I wouldn't say any trauma per se, but there's a lot of research on sort of what is the basis of anxiety, and what are the biological and sort of early life experiences that bring about anxiety, and there's a ton of factors, and it's hard to generalize as to what would be the issue. Can hormonal things worsen anxiety? Absolutely. Can thyroid conditions worsen anxiety? Totally. Can dietary things influence anxiety? Absolutely. And that's not, I mean, we typically don't leave those stones unturned here. But sometimes it's not your thyroid, you know, sometimes it's not your adrenal glands, sometimes it's not per se, I mean, as the root cause. Excuse me, sometimes it's just the way you think about the world, you know, which is one of the reasons why I do regularly recommend therapy, because I think that's a valuable addition.